All right, thank you for staying tuned. We are still discussing Lagos State mandatory health insurance. Yes, and before we went on break, I was saying that our guest we still have with us Dr. Emanuela Zamba. She's the permanent secretary, Lagos State Health Management Agency, LASHMA. All right, so I said I want you to elaborate on the universal health coverage. Can you walk us through how this will pan out?
So universal health coverage simply just means that you are trying to provide services to as many people as possible, as many services as possible to as many people as possible at a cost that is as affordable as possible, right? That's what universal health coverage is about. So it's a journey. You will never get to Uhuru, as they say, because you cannot have all services ever provided at an affordable cost. There are some services that by the virtue of that type of service, they are expensive. But everybody has to start from somewhere, right? So for countries that you say have achieved UHC, let's look for some that's similar to us, like Thailand, for instance, that is in Asia and has like the kind of population that we are working with here. What they have a finite set of services. You can access that from all facilities. It covers everybody in the population, and it is, at an affordable cost. Now, the beauty of social health insurance is that as you go along, as you progress, and you build that pool more, you are able to add in more services to be provided at this relatively affordable, negotiated cost for everybody. So eventually, people get much more services as you journey into UHC, over time, without having to break the bank to get it, right?
Okay, let's talk about the affordability now. Is it one scheme fits all, or there are classes of this scheme?
So for social health insurance, there must be what you would decide as your basic minimum, right? Below which nobody should go. That is what we have determined as a basic minimum. Then, of course, you can have layers on it. Private health insurance, for instance, would give you added layers. Even within the social health insurance plan that we have a plan for seniors, simply because they are more high risk. They have the tendency to seek services more because of their age and, the accompanying issues and so on. So you can have variations, so to speak, but there must be a basic minimum to which everybody, regardless, has access to.
Okay, so let's talk about Ilera Eko. Some people have raised concerns about the quality of healthcare delivery they have gotten, or healthcare service they've gotten. Some also, we had a guest here on Monday, and she raised concerns about the quality of drugs at the community pharmacy. So I'd like you to respond to that.
Okay, so I will address it in, I think, two ways. The first is that we should always be mindful of the fact that Ilera Eko is not a private health insurance plan. It is a social health insurance plan. And what that means, it is for everybody, and it must be as affordable as possible. That is not to say that quality is going to be compromised. Now, I think the general perception of general public, because there wasn't any social, we're working in a vacuum. Yeah, this is a pioneering initiative of the state, is that if you want to get well, you have to buy the most expensive drugs that are highly branded and so on. And those are the ones that will cure you, quote unquote, right? There is a whole spectrum of drugs that we call generic drugs, and they are brought out simply because of affordability. Now, whether you take that, you get a branded drug or you get a generic drug, the pharmaceutical component of the drug is the same. What you buy when you buy the branded drug is the name. I would use the example of a lady's handbag. You have a Louis Vuitton or a Chanel, which is like the high end. You have those that are mainstream, like the Tory Burches and so on. And then you have those that you can walk into any shop and buy a leather bag. They all have different prices. They all perform the same function. The Louis Vuitton bag is not going to last longer than the other bag that you bought, simply because they are all made of leather. You understand? So what you're buying is the name, you're buying the brand. Does not mean that the generic drug is less effective. It is just as effective as the branded drug, and it is affordable, and that is why the social health insurance plan leans towards the generic drugs. We need to get you well. it is not about the expense of the drug. It is about the efficaciousness of that drug. And so I think people already have this mindset that if I'm going to have, let's use Ampiclox for instance, it must be that one that is in the blue and white pack. Otherwise, I want. It's a psychological
so it's a mind
malaise. It's a mind thing, yes. And people need to disabuse their minds that nobody's going to give you substandard drugs. There's nothing like that. All these drugs are NAFDAC
approved.
They are NAFDAC approved. They have gone through rigorous tests and so on and so forth. And NAFDAC has stamped on that drug simply because they see that that drug will provide the cure that it is supposed to. It will do what it has said it is going to do. So there is no way anybody is going to be given any drug that is not NAFDAC approved or is not efficacious enough. Just don't be looking for all the bells and whistles. Let's just be functional, really.
Thank you.